May I request the panelists to kindly turn on their videos as we will get our webinar started. Dr. Ranganathan and Dr. Divya, we'll be starting a webinar now, requesting you both to turn on your cameras and we can get the session started. All right, while they turn on, let's get this webinar started to avoid any other delays. So, hello and a very good morning to all of you present here. This is a bright Monday morning, and we are here to learn and get insights on a wonderful topic, I must say. It is very rightly understood that the brain is the powerhouse of the human body, and we have three amazing doctors who are here to prove that in today's session. My name is Hiba, and it is my pleasure and honor in welcoming you all to the webinar on understanding brain health, brought to you by Kauvery Hospital under the Hindu Wellness Series. We are honored to have with us three amazing doctors. Firstly, we have Dr. G. Joss Jasper, Head of Brain and Spine Surgery, Kauvery Hospital, Trichy. We also have Dr. Ranganathan Jyoti, Director of Neurosciences, Kauvery Hospital, Chennai. And lastly, we have Dr. Divya Selvaraj, Neurology and Neuroscience, Kauvery Hospital, Salem. Let's get this multiverse of Trichy, Chennai, and Salem started. Our first speaker will be Dr. G. Joss Jasper. Doctor has completed his PG in neurosurgery at Stanley Medical College, Chennai, and PG diploma in medico-legal systems in Symbiosis University, Pune. He's also been instrumental in setting up the Department of Neurosurgery and Neurology in KMC as Kauvery Brain and Spine Center. He's also helped establish the first exclusive stroke care center as per the European Stroke Association criteria in KMC Tenor. And with nearly 20 years of experience in being a specialty doctor, he will now be the perfect person to address us on the topic brain trauma. Welcome, sir. The floor is all yours.
Good morning, madam. Thank you for the warm welcome. With this, I'll actually start my screen sharing. Yes. Today is a very important day. We actually celebrate Brain Health Day, or we commemorate Brain Health Day. This is when we are trying to get the message to the public that brain health is very important. And I am actually going to focus on a very small part of brain health about relating road traffic accidents or accidents in general with brain health. Now, we must know what our brain is first before we really start talking about brain health. Our brain is made up of 86 billion neurons. Milky Way has only 100 billion stars. So you can see how many neurons or brain cells we have. And these brain cells have literally 1 quadrillion network connections. And it is this network connection that actually helps us to decide on who we are and all that. A piece of brain tissue the size of a grain of sand contains almost 1 lakh neurons. So that's a huge number. And the average brain is almost 2% of the body weight, but uses 20% of its energy. And information in the brain travels at almost 560 kilometers per hour, which is very fast. And the average memory in average human brain is around 2.5 petabyte. We know our phones have maybe 512 GB or 1 TB at the most. This is equivalent to 2,600 terabytes of information. The world's best supercomputer, the Frontier, has only 9.2 petabytes, which is approximately the memory found in 4 individual human beings. So this brain decides our opinions. It makes us fall in love. It makes friends with others, reads the news, sees the world, and understands love, hate, fear, etc. But this brain that does all this, do we really take care of it? No. And that is why I'm talking about road safety. Because in India, somehow we Indians are not bothered about our lives, not bothered about our brains, or not bothered about our head. And we see it day in and day out in the roads every day. One second. Why is this? Next, sorry. Mundana slide. Yeah, yeah. Yeah, then go to slide 7. Thank you very much. Okay. So, Tamil Nadu roads in a day, there are 200 accidents which are significant accidents taking part in Tamil Nadu every day. 50 deaths a day. This is a huge number. So, how does a head injury affect the brain? Here you can see a CT scan of a face. This patient obviously did not wear a helmet, and you can see the amount of injury that is present in the skull. It can also cause bleed inside the brain. You can see there are two different types of bleed. The first bleed is what we call as a bleed, which looks like a lens, a lenticular bleed. This is known as the extradural hematoma, where the bleed occurs just outside the brain. The second one is a semilunar or a moon-shaped bleed. And this usually occurs just above the surface of the brain. Apart from this, you can have bleed inside the brain also. One another worrying injury that we see quite often is known as diffuse axonal injury. I already told you we have so many billions of neurons or brain cells, and in a high velocity injury, these nerve cells are stretched like a rubber band. And if the stretch is mild, after some time it comes back to normal. If the stretch is severe, the rubber band snaps, and that is what happens to the neuron also. This is known as diffuse axonal injury. Here, very often the CT will be normal. It will only be the MRI that can pick up this diffuse axonal injury. Apart from this, you can have something known as a primary brainstem injury. Now, the brainstem is the part of the brain that decides our vegetative function. It decides our consciousness, the very act of breathing, the way our heart beats, the BP, etc. And if there is damage to the brainstem, chance of the patient surviving is actually very minimal. So how do we prevent RPA? I'm going to mainly talk about how do we protect our safety. The first thing which we do not do is this: we do not obey traffic rules. So, obeying traffic rules is the simplest and the most basic thing that we can do. For example, none of us respond to a red light properly. Stop before the amber turns to red. The red light, stop before the red light. But we Indians always try to go past before the amber turns to red. Stop before the stop line. There is a reason why there is a line there to tell you where to stop, but we do not stop. In Dubai, for example, the fine for going beyond the red line or breaking a red light is 50,000 dirhams, which is almost 12 lakh rupees. And the vehicle is confiscated immediately. Here, because our rules are not that strict, we all believe in disobeying a simple basic norm like stopping before a red light. We have no respect for one-way signs. We must avoid driving in the wrong way. We think we are saving time, distance, and fuel. But one visit to the hospital after an accident is enough to make sure you have lost all the time, you have saved all the fuel and the money you have saved. Obey traffic rules, right speed for the road. If the road says 40, do not drive at 5 or do not drive at 140. Drive at the right speed. Inside the city, there are fixed speed norms and this has to be exactly followed. Follow lane discipline. Do not ride in the middle of the lane. And wherever police men are present, obey their rules. Alcohol. This is again a big thing we see now. In fact, Tamil Nadu has made it mandatory that any patient coming with a head injury, blood serum levels of alcohol has to be tested, because then insurance will be denied. All benefits, financial and economic, will be denied to the patient who drives under the influence of alcohol. Alcohol slows down the brain and the reaction time needed to respond to a crisis increases. So don't drink and drive. Cell phones, this is another thing that has really become a huge part of the problem. People think that their cell phones are necessary, including texting, but mobiles distract you, mobiles kill. Don't forget that. Helmets. We Indians do not believe in wearing the helmet at all. But helmets again save lives. People say it, distorts my hair does not look good, or they say I develop neck pain. But what you need to remember is when you fall down, the helmet is what stays between your head and the road. It takes the brunt of the injury and makes sure that the head and the brain inside escapes safely. And always remember there are different types of helmet. If you drive a higher speed vehicle or a vehicle which is capable of higher speed, please invest more. Buy a carbon type of helmet, which is lighter, safer, but definitely more expensive. And always buy a full face helmet because that is the only one which will protect the head. This is an example of a patient who didn't wear a helmet, didn't stop on time, went and banged against the rear of a lorry, and he ended up needing a plate like this. In cars, always use seat belts and buy cars which have airbags in them. Airbags do not add to the cost, they actually saves lives. A seat belt without an airbag really does not work effectively. A airbag without seat belt does not work effectively. They sort of enhance each other's protection. Always buy cars with safety. This is just a small video to show you the amount of force that is generated in an injury. So you can see if this guy was wearing a seat belt, he will not have been thrown so much. Inertia, this is all about physics. Always make sure children sit in the rear with their baby seats. India, we carry the baby in the mother's lap, and in case of an accident, the baby is actually compressed between the dashboard and the mother's body. And always the children suffer more. So always make sure the children sits in baby seats. And this is another thing we need to remember, blind spot. Whenever you overtake a large vehicle, kindly do not overtake in the blind spot. The guy driving the bigger vehicle, a bus or a lorry or even a car, has to see the two-wheeler. So when you come in a two-wheeler, make sure you make eye contact with the driver. If the rear mirrors are set right, you will see the eyes of the driver. And when he sees you, he knows you're overtaking and gives you space. Always maintain your vehicle, service them regularly, check the lights, especially the rear lights. Check your rear view mirrors. When you wear a helmet, if you do not have rear view mirrors, you cannot see what is happening behind. Check your tires and your brakes. Stay healthy. If you have low sugar or very high BP, you're not able to concentrate on driving. If you cannot see or hear, obviously, you're a danger not only to yourself, but to the society at large. So, in short, always obey rules, don't drink and drive, drive safely, use helmets and seat belts. Safety always begins at home, and in case of a vehicle, it always begins in your vehicle. Just two more slides. Patients always ask me, people ask me, why are head injured patients treated in the ICU? They are always treated in the ICU if they are unconscious because the patient is totally dependent on others for all their basic functions. Breathing, they need ventilation, food through the tube feeding, removing secretion through suction, or even turning in bed, they'll need support systems, which is why ICU is maybe usually used more often in patients who are unconscious after head injury. Similarly, why ventilation? An unconscious patient cannot protect his airway, similar to a baby. After we feed the baby, we always make sure we take the baby to the shoulder, tap it, and burp it, and only then we actually make the baby to sleep. And in initial stage of head injury, if he cannot breathe well to protect his life, he needs a ventilator. Ventilator gives enough oxygen, brain rest, and brings down the pressure in the brain also. So, in closing, large vehicles always drive with respect to others' lives, others' property, others' vehicles. Small vehicle drive with responsibility and with a sense of safety to self. Be a road hero. Always drive patiently and safely. Think about others, give way, and make our roads stress free. So keep your head, don't lose it. On behalf of the Kauvery Brain and Spine team, thank you, dear of the fellow members, for listening to the speech. Thank you.
Thank you very much, sir, for sharing your thoughts. And I think it's a very interesting topic that we all should be very careful about next time we go on road. So thank you very much for sharing your thoughts on that. Next up, we have Dr. Ranganathan Jyoti, Director of Neurosciences, Kauvery Hospital, Chennai. Specializing in a wide array of neurosurgical procedures, Dr. Ranganathan Jyoti offers comprehensive care for various conditions affecting the brain and nervous system. He specializes in brain surgeries, including brain tumor resection and addressing head and spinal injuries. Additionally, his expertise includes trauma surgeries with emergency interventions to manage traumatic injuries as well as spinal surgeries and spinal fusion. He also specializes in pediatric neurosurgery, where he manages children with neurological conditions and provides pain management procedures to alleviate chronic pain related to these issues. He will now be addressing us on the topic brain tumors. Welcome, sir. The stage is all yours.
Thank you. The next branch in this field of neurosurgery is brain tumors. So I'm going to talk on the brain tumors. This is the brain tumors are the fifth most common tumors in the human body. There are about 100 different types of tumors. When a patient develops a tumor, what are the common symptoms for which they meet a doctor? The most common is headache. The headache, unlike a migraine headache, which will be splitting, this will be a dull aching headache, most common in the mornings, and may be associated with the vomiting. The vomiting will be projectile in nature, and to a certain extent, the vomiting may bring down the headache. Next is the fits, seizures. The seizures, for the first time in an adult or an adolescent who is not a known case of fits, not a known case of seizure, if they develop fits for the first time, those patients also should meet the doctor immediately to investigate further whether they are developing any tumor in the brain. Other signs, clinical symptoms, are slowly they may progress in the weakness of limbs, one side of the limb, unlike in a stroke, which occurs all of a sudden, the weakness, this gradually progresses. In the same way, he can develop benumb sensation, or sensation may decrease on the part of the body. He may have a deterioration in the vision. He can have a double vision. He can have a deterioration in hearing. These are some of the symptoms for which they go to a clinician, a physician, or a neurologist or a neurosurgeon. And immediately after this, after clinically examining the patient is asked to take a CT scan or MRI. The MRI or CT scan can bring out the picture of the tumor developing in the patient. Most often, the sort of tumor which the patient has developed can be brought out with the MRI to a certain extent, but that may not give the exact diagnosis. To have an exact diagnosis on what type of tumor the patient is suffering from, the patient needs a surgery from where the tumor is removed, taken for histopathological examination, and only confirms what type of tumor it is. When you come to what type of tumor it is, there are two different types. One may be a malignant tumor, another may be a non-malignant tumor. A non-malignant tumor accounts to about 70 to 71% of the total number of tumors you see in the patient, and malignant tumor account only for 29%. The malignant tumors, of this 29% of the total tumor you see, the malignant tumors, the 60% of the tumors or malignant tumors are less malignant, whereas remaining 40% are highly malignant tumors. Of those, the glioblastoma multiforme forms a major part, that 40% of the highly malignant tumors. When you go for surgery, the non-malignant tumors, that is the benign tumors, which account for 70 to 70% of tumors, When you totally remove, the patients are totally cured. They are put back to normalcy. In a malignant tumor, if you are going to operate on the tumor, that also has to go for a total excision. But in a less malignant tumor, the prognosis is good. Whereas in highly malignant tumors, you can give a good prognosis if the tumor is totally excised. And malignant tumors should be subsequently followed up with radiotherapy and chemotherapy. Unlike in non-malignant tumors, the surgery alone is suffice. So when you talk about the excision of the tumor, the outcome of this brain tumors, how do you rate the outcome of the tumor? If the tumor is going to be a non-malignant tumor, the outcome, that is nature of the tumor, decides on the outcome. Non-malignant tumor, the outcome is very good. And the location of the tumor, if the location is going to be deep-seated, in where you have the surgeon has to go deep into the brain, crossing all major parts, the outcome may be little difficult. And also comes the precision of the tumor. So you have the slide now. The precision of the excision of the tumor. So nowadays, share screen. For say, when I talk about the precision of the tumor, there are so much advances in neurosurgery, wherein now you can precisely remove the tumor without giving any neurological deficit to the patient, for which you have a CT scan, MRI scan with very advanced features. You can you have a PET scan which can give you whether the tumor is highly malignant, less malignant, or non-malignant. A microscope with very good illumination, magnification, and fluorescent compatible microscope, wherein the final bit of the tumor which is left behind after removing the major part can be brought out with this fluorescence and removed totally. Endoscope, neuronavigation. Neuronavigation is like a GPS, wherein you navigate around the brain and remove exactly what is necessary without injuring the neighboring normal tissues. And to remove the tumor, you have a CUSA which fulgurates the tumor and sucks the tumor. And intraoperative neuromonitoring, craniotomes, intraoperative C-arms, and so on. So armamentarium has advanced so much to give a precise excision of the tumor without producing much of neurological deficit. So this is the huge microscope exclusively used by the neurosurgeon in the theater for operating on neurosurgical patients with a good illumination, magnification, and this is a fluorescent compatible, wherein you can see the every bit, last bit of the tumor that can be removed with the fluorescence imaging. This is a neuronavigation set up in the OT, wherein all the images, CT, MRI, angiogram is fed into the computer, and the computer with the wand you have in the hand, you can draw the tumor in the skull beforehand, and you can go inside the tumor gradually, and each time seeing that you are going inside the tumor, because some malignant tumors, highly malignant infiltrating tumors, and the brain tissue may look alike. So you have to remove only the tumor, for which this neuronavigation will be very helpful. This is a huge tumor in the posterior part of the brain, wherein you navigate. So this is a marking done on the scalp using the neuronavigation. Then and this is another tumor in a deep-seated tumor away from the surface of the tumor. for which you start navigating. This is a navigation where exactly the tumor is present. Once you navigated, you get through a small incision in the brain, you get inside and each time you navigate that you are only inside the tumor and you remove. And now you give the fluorescent dye, and that to fluoresce the last bit of the tumor, which fluoresces, has been it's being removed. And that is the empty space. It is in the deep sea, and that is confirmed with the navigation that you have gone all around. This is the post-operative CT where you see only the empty space. This is another tumor, the anterior skull base, which is a pituitary tumor, wherein you previously we were going through the skull, but now with the advent of endoscope, through the nose itself, you get into the tumor. Through the endoscope, you get into the tumor, and this is where I'm removing the bone from the undersurface and started removing the tumor from inside. So the tumor is being removed totally from through the nose itself and is being covered. This is another tumor in the anterior skull base, wherein the CUSA is being used to fulgurate the tumor, and remove the pieces of the tumor easily, so that you don't pull the normal structure around. Here, using the CUSA and remove the tumor, and you are seeing the optic nerve from which you remove the tumor without disturbing. Thank you.
Thank you very much, Doctor, for sharing your insights on that topic. I'm sure people will have a lot to learn from through your presentation. Also, to the audience, we have a question answer box. So, in case any of you have any questions for the doctors, you can put that up in the question answer box. And once presentations are done, we will answer all of your questions. So, that's about it. And now we have our final speaker for the day. We have Dr. Divya Selvaraj, Neurology and Neuroscience, Kauvery Hospital, Salem. Doctor has completed her DM from Government Mohan Kumaramangalam Medical College and Hospital, Salem. She has distinction in anatomy and biochemistry along with the Ishwaran Shakuntala Gold Medal for proficiency in pathology. Apart from this, she also has a Dr. K. Vasudeva Rao Prize for proficiency in chest diseases. She is also backed the Dr. V. Balagopal Raju Award certificate for scientific paper titled A Comparative Study of Efficacy of Salbutamol via MDI spacer and nebulizer in the treatment of acute asthma during the 39th annual session of the IAP TNSC. She'll now be addressing us on the topic brain seizures. Welcome, Doctor. The floor is all yours.
Good morning. Thank you, Hiba, for the kind introduction. On this World Health Brain Health Day, I would like to talk on seizures. Seizures, the myths and facts. So, what is the common myth among the patients, especially in a rural population, is that fit means it has to involve both sides of the legs and the arms with the unconsciousness and foaming in mouth. It is not so. It can vary from brief lapses of attention, lip smacking or chewing movements, or any muscle jerks or altered behavior. And it can be focal, just unilateral. One side of the limbs may be affected, or it can be generalized to involving all the four limbs. The second common myth is that the people think it is a non-treatable condition. The patient has to live with the epilepsy for their lifelong. It's not so. More than 70% of people living with epilepsy could live seizure-free if properly diagnosed and treated. And they can also lead a normal and successful life too. So many were not seeking treatment because of the still prevalent social stigma that if we say that we have seizures, people will not be in contact with us. So they feel shy to come to the hospital and get appropriate treatment. And this is called treatment gap. You'll not believe many famous personalities like Alexander, Julius Caesar, etc. All they had suffered from epilepsy, but still they could able to achieve in their life. Another common myth is that the people think it is a contagious disease, it is a mental illness or evil possession. It's not so. It's not at all a contagious or evil or sacred illness. They can also marry and have children and lead a normal and happy life. So then what it is? It's just an electrical disturbance in the brain. Normally, there are millions of neurons, as sir already told, and there will be connections throughout neurochemical transmissions will be going on. When there is over voltage, like any electrical disturbance, that leads on to seizures. That results in loss of awareness or consciousness, disturbances in the movements or sensation, even some touch sensation, vision, hearing, taste, anything may be affected, or behavioral disturbance too. We call it as epilepsy when this occurs more than twice without any provocation. So, what are the risks associated with these types of seizures? They tend to have more physical injuries like bruising, fractures, and burns, and they have high rates of anxiety and depression because in school or workplace in public, if they get seizures, they will be depressed or they will be anxious. What the friends they will think of about them, like that. Another dreaded complication is SUDEP, sudden unexpected death in epilepsy. It is estimated that the prevalence of premature death among the epileptic patients is 3 times higher than in the general population. The common preventable causes are like falls, drowning, burns, and prolonged unattended seizures. The relatives will be seeing the next day the patient would have found dead. The overnight the patient would have got seizures and frothing in mouth. Nobody would have noticed it. So who are all more prone for this? It can affect people of any age, both sexes, so any social background or any level of intelligence. Around 50 million people worldwide have epilepsy, making it one of the most common neurological diseases nowadays. Common causes, what we are seeing is fetal brain damage, like due to hypoxic insult, any perinatal delayed or prolonged labor can result in fetal hypoxia, or any congenital malformations or genetic conditions. Febrile seizures is one of the common causes we see, and no need to worry about these febrile seizures. Whenever the child gets high temperature, the child may go in for seizures. The common stage is from 6 months to 5 years. Then among the old age, the common causes are stroke. Both ischemic stroke and hemorrhagic stroke can lead on to seizures. And another common infection reason is the brain infection. Next most common is the metabolic parameters, any low sugars or low sodium levels or high urea creatinine. These all metabolic parameters can produce seizures. Next cause is the alcohol or any toxin intake, like any poisoning like organophosphorus or any poisoning for that matter, they can produce seizures. And last but not the least are the brain tumors and head injury. As previously discussed, they are the main cause for seizures. So what we can do to prevent these seizures? First of all, as Sir said very in detail about the head injuries, we should prevent head injuries by wearing helmet and avoid road traffic accidents and any sports injuries. The next is the perinatal care. Already in our part of country, Tamil Nadu, it is excellently being carried out. The antenatal checkups and perinatal care is being done well, leading on to the less number of cases, birth asphyxia cases we are seeing nowadays. Previously, there are many children with diagnosed as cerebral palsy. They tend to have refractory seizures, but now the incidence has come down drastically. Another thing we can prevent is that we have to control our blood pressure, sugar, and obesity. We have to reduce the weight and avoid any substance abuse like tobacco and alcohol, and avoid some infections due to swimming in contaminated water. Recently, you would have heard about the primary amoebic meningoencephalitis reported in Kerala because of the contaminated water in which they swim. Next common is the eating contaminated food or water. The commonest is the tapeworm infection, which leads on to neurocystic sarcosis. These are all the preventable causes we can do to avoid seizures. So what are the do's and don'ts? Whenever you are nearby a seizure patient, you are attending, either your relative or unknown person, what you can do as a first aid is that you can call the ambulance and stay calm and remain with the person and time the seizure if possible. Gently roll them onto one side and keep them safe and protect from any hazards. Place something soft under the head and loosen any tight clothing if they wear. Do not restrain the seizure movements. Don't try to control the movements when they're actually seizing. Do not put anything inside the mouth and do not give any iron rod or keys while seizing. This myth is also still prevalent, that in rural areas, even in urban areas also, people think that if they give keys or some iron containing material, the seizures will stop. There is no scientific evidence for that. And also, you need not introduce anything inside the mouth or clear the mouth. You can just put them onto one side so that the secretions or any saliva comes out will drain out. These are all the things you need to do as a first aid when you are attending a seizure patient. In case of epilepsy patient, already known seizure patient, what they can do is that they can maintain an epilepsy card, an ID card like thing with their in their pocket wherever they go with the details of their medication, and they should take medicines regularly at prescribed time. And there should be a 7 to 8 hours night sleep. That's a must. Avoid any sleep deprivation, because sleep deprivation is the second most common cause of recurrence of seizures next to the skipping medications. And avoid fasting, eat in time, avoid stress by doing any yoga or meditation, and stop alcohol and other substance abuses, and avoid swimming or driving unattended. So how we diagnose? It's 90% clinical diagnosis based on the history, especially from the person who witnessed the event. Next, we can do brain imaging to find out any structural causes. Either CT scan or MRI can be done for knowing any structural causes. Then electroencephalography, it's like our ECG. It can monitor the focus of the seizures, whether it is focus or focal or generalized. Advanced scans like PET scan, SPECT, and magnetoencephalography are available in tertiary care centers, a few higher centers only. All these are not necessary for initiating a treatment. The first main thing is the clinical diagnosis decided by the neurologist. So next thing, if they need any of these images, they will advise you accordingly. Coming to treatment, symptomatic seizures, for example, the person had alcohol and alcohol related seizures, or any antenatal patient having eclampsia and related seizures, they doesn't require long-term anti-seizure medications. 50% of the persons with the seizures, they achieve seizure control with one anti-seizure medication. Only 20 to 30% will require multiple medications. Surgery may be required for refractory cases if focus is identified. I told you the advanced scans like PET, SPECT, MEG are all used for this identifying the focus of seizures, so that surgery will give a cure for them in case medicines don't work. A few words on Indian laws and epilepsy. What does our law states that a person with epilepsy alone is not considered as a person with a disability. If they have any associated skeletal abnormalities or poor vision or locomotion problems, then they can be included under Persons with Disability Act. As per current laws, a person with epilepsy in India cannot drive. There are many considerations for this, like in US and other countries, they consider person if they are seizure free for more than a year, they can drive like that. But in India, if the person is found to have epilepsy, the driving license itself is not permitted. Person with epilepsy can have a legally valid marriage, and epilepsy is no more cause to claim for divorce. Previously, it was not so. Any person who is insane or epileptic is not a legally valid marriage, but this have been changed recently, and now it is not a legal problem. So finally, treat it or defeat it. Beware of seizures, take care of your brain, and lead a normal and happy life. Thank you. Thank you for the opportunity.
Thank you very much, Doctor, for sharing your thoughts on that. We're sure people will have a lot to take away from you. So thank you very much for that. We will now have a few question and answer sessions. So in our chat box, a few of them have put up questions. In case they are for a particular doctor, then you can answer the question and let us know how it goes. So our first question is, my sister has MRI left periventricular leukomalacia, right spastic hemiparesis, seizure disorder, and seizures every day. Is this problem curable? I think Dr. Divya can take up this question since your topic was about brain seizures. Yes.
Yeah. The child would have been born as preterm, I guess. So this periventricular leukomalacia is commonly seen in preterm children with right spastic hemiparesis and seizure disorder. You need to consult your neurologist for seizure treatment. They can control with medications, and if not possible, they will go for advanced scans, and if needed, any surgery can be done. They will decide. For the spastic hemiparesis, the physiotherapy and occupational therapy plays a vital role in improving the child's ambulation.
Thank you very much, doctor, for sharing your thoughts on that. Our next question goes, if a patient goes to a hospital with the symptoms of brain tumor, what if it is diagnosed as a mere health issue and treated with general medicine, and the symptoms are cured with those medicines fully, then after years it is found to be actual tumors? Who would like to answer the question?
Yes.
Yes, doctor.
Yes, if the patient, no, if it is going to be a malignant tumor, it is going to be a fast growing tumor. The patient will have, because I said in a brain tumor, one of the symptoms is headache, vomiting, and the seizures. A patient initially goes to a doctor where there's been some health issue, has been treated, and subsequently comes home, but he will continue to have headache or seizure, whatever the symptoms, and if he is going to develop a weakness of limbs, the weakness of limbs is going to deteriorate, because this is not going to be a fast one as you see in a stroke or head injury. It is going to be a gradual, maybe a highly malignant tumor or a non-malignant tumor. Gradually, highly malignant tumor in a week's time or a month's time, in a non-malignant tumor in a year's time. And subsequently, if they take an MRI or a CT scan, which shows a tumor, the patient has to be subjected to for surgery. The medical management in these patients are only treatment for fits. They will develop fits. So prophylactic anticonvulsants should be given. And because of the tumor, there may be a swelling of the brain, for which you can start on anti-edema measure to bring down the swelling. These are only initial treatment. Subsequently, the patient has to be subjected to the surgery depending upon its pathological diagnosis. The patient's survival time may be given exactly. If it is going to be a non-malignant tumor, the patient is going to be cured completely subsequently. And the patient neurological deficit also can come down. If the patient is going to have a malignant tumor, subsequent to the surgery, the patient has to be subjected for radiotherapy and chemotherapy for his survival, for depending on the grade of the tumor. Less malignant, longer duration of survival. Highly malignant also can survive, but a little less.
Thank you very much, doctor, for answering that question. We move on to our next question. It goes, can the tumor occur in the same places or different places? And what are the red flags to look out for in case of tumors?
Yeah, depending. There are certain tumors, certain benign tumors, like multiple, many. There are certain genetic factors where they can develop multiple tumors, which are all benign, but located at different places. And those each, depending on the size and this thing, not everyone, all the tumors in a single patient will be large. The larger tumor has to be removed first, and patient has to be periodically reviewed. And if the subsequent consultation, if another tumor is going to grow, you have to remove that also. There is nothing you can stop that benign tumor from occurring. But if it is going to be a malignant tumor, I said highly malignant tumor, highly like a glioblastomas, they tend to recur, and after 2 years or 2 years, they might recur. And at that time, if the patient is in a general condition is good, and if it is possible, you can once again keep your knife, remove the tumor, and subject him to booster radiotherapy and chemotherapy.
Thank you very much, doctor. I'm sure that answered the question of the person who asked it to us. Our next question goes, can you please let us know about the good and bad food for the brain? Anyone who wishes to answer can take up the question.
Good or bad food, we need to eat uncontaminated foods, or well washed and well cooked food. For any meat or any even vegetables for that matter, if it is contaminated fruits, we eat just like that. So we have to wash it and cook it properly before eating.
Thank you very much, doctor, for sharing your thoughts on that. Our next question goes, I'm 86, my memory is poor. How do I improve it?
I'll answer that.
Sure, sure.
Yeah. Normally, if you use your brain regularly, it its memory power improves. So we suggest some brain exercises. They can do Sudoku, they can do crosswords, and there are lots of, or you can learn a new language, or you can play cards, meet friends, talk with them. You can also learn a new hobby, for example, like playing music or something, because all these will reactivate other parts of the brains which are latent and memory improves. Apart from that, obviously decreasing stress, improving your diet habits, normal diet habits, exercise, all that also contribute to the memory power of the brain.
Thank you very much, doctor, for giving us the answer to that question. Our next question goes, my daughter, who is 16 years old, underwent brain surgery in 2021 for suprasellar epidermoid cyst. Post-surgery, she developed hypothyroidism. During her recent checkup, hormone profile test has been done. Her cortisol levels are 4.75. Please advise.
Yeah, the cortisol level is a bit low. And the cortisol level you have to see in the morning and the evening. But both in the morning and evening, 4.4, the evening, it is a little less only. So you have definitely at that level, if you are going to in a suprasellar region, epidermoid is removed, there is a chance that hypothalamic disturbance can disturb the hormones being by this pituitary and the hypothalamic axis. So for that, you have can supplement the patient with the external drugs. Because for cortisol, you give a steroids, and they have to be on a permanent steroid. And for hypothyroid, you can give the thyroid tablets, thyroxine tablets, which can be substituted and have a normal life. When you go for a total removal, can this can occur in that area, because that area is not even 1 centimeter width at that area. From the anterior, you have to go at least 20 centimeter depth to go reach that area of 1 centimeter diameter of that tumor to remove it. And with that amount of precision, with the latest navigation and microscope, you can do it. But in the process, you can have this problem, which can be easily treated with the drugs.
Thank you very much, doctor, for answering that question. We'll move on to our next one. It goes, due to high screen time, which is nearly 10 hours due to IT work, this makes the brain less responsive. If so, how do we overcome this pandemic for brain wellness?
Being a general question, I'll take it. Yeah.
Yes.
So increasing screen time damages the brain because our brain is used to dealing with concrete things. In the sense, when you do something, for example, when you talk with somebody, you talk, then you listen, then you take a break, then you turn around, you do all those. So your brain is doing lots of things at the same time. When you sit in front of the screen, bad posture, you end up with back pain. Sedentary lifestyle, again, you end up with diabetes, hypertension, and all that. Stress, again, bad. And screen time by itself, especially we see lots of youngsters now who watch small reels, less than 20 seconds or 30 seconds. Their concentration really drops. They develop attention deficit. In the sense, you ask them to read something, they're not able to read anything more than 2 or 3 pages. They're not able to watch a full length movie for 2 hours because the brain is so used to just dealing with short term items. So these are not good for the brain. So when you work, for example, in IT profession also, you have to take a small break once in 20, 30 minutes, at least for 2 to 3 minutes, do something else. Get up and walk, move around, jump, exercise. So all those are small things that you can do to make your brain healthier when you work in the IT industry.
Thank you very much, doctor, for sharing your thoughts on that question. We move on to our next question. It goes, is there any supportive evidence for reducing the tumors and seizures through non-medical intervention methods?
No, there is nothing. It is, look, a patient develops a tumor. Everyone have got a gene which is supposed to be a tumor suppressor gene. When tumor suppressor gene will not allow the extra growth or unnecessary growth in the body. When the tumor suppressor gene is knocked off, you develop a tumor. So it can be anywhere in the body. So that is, there are so many factors which knocks down the tumor suppressor gene and development of the tumor. We may not know what is the cause for it, like radiation can cause. So there is even a cell phone using for a long time. There are a lot of researches going on where you can develop a tumor in the nerve, and you have the potential of hearing. The eighth nerve autonomous supposed to occur, and the radiation-induced tumors. So you cannot, with the drugs, you cannot suppress the tumor formation. And about the seizure, Dr. Divya will tell you.
Yes, Dr. Divya, do you have anything to share on this question?
Yeah, seizures due to tumor, once we remove the tumor only, we can control the seizures. Otherwise, the focus will be constantly there to trigger the seizures. We do give medicines until the patient is being taken up for surgery.
Thank you very
Well,
much, Doctor.
I like to just add a point
Yes,
there.
Doctor, please.
When patients develop brain tumor, most of them do not want to accept the diagnosis. That is a stage of grief that we all go through. And when that happens, lots of patients try to move away from medicine as it is being practiced, the modern medicine that we see, and go to alternative places. And lots of these places do suggest non-medical or even, alternate therapies, but none of these alternate therapies have been proven to either control seizures or decrease tumor size. So the message that I want to send to our audience is alternate medicine does not work in tumors and seizures. Always meet the right person and get it treated.
Thank you very much to all the doctors for sharing your insights on that question. We move on to our next question. It goes, what type of diet can be given to adults and children with epilepsy?
So, as we discussed already about the diet, it should be a balanced diet with adequate amount of nutrition. So they should consume fruits, vegetables. But we advise a ketogenic diet for severe epilepsy patients. Those who cannot control refractory seizures, they tend to have more number of seizures. We advise ketogenic diet where the proportion of fat is more than the carbohydrate or protein. So that is a special diet designed for some people who have refractory seizures or genetic epilepsies, not for all. Generally, we do tend to have balanced diet and on-time meal. They should not skip any meals, or they should avoid fasting like that.
Thank you very much, Doctor, for sharing your thoughts on that. Our next question goes, how can I prevent a person from biting their tongue during seizures?
Yeah, not everyone can use this, but non-epileptic patient, they are getting frequent seizures. They can use a mouth gag, which is made of plastic, which are available in hospitals. Even epileptic patients, they can buy and they can use it during the seizures.
Thank you very much, Doctor, for answering that question. Our next question goes, what is the role of a clinical psychologist in these disorders?
In seizures?
It just says these disorders. I think seizures.
Okay. Neuropsychological assessment is must because patients frequently throwing seizures, we need to assess their level of intelligence and how much they have been affected due to seizures, their learning capacity, everything needs to be assessed. They will
Yes,
have associated anxiety and depression too, that needs to be addressed.
Right. Thank you very much, Doctor, for answering that question. Our next question goes, does meditation and disciplined lifestyle really help to maintain a healthy brain?
Yeah, of course. We need to reduce our level of stress by doing some yoga or meditation or discipline. Self-discipline is most important. Any work for that matter, we need to have adequate rest, like 7 to 8 hours of night sleep and a balanced diet.
Yes, thank you very much, Doctor, for sharing your thoughts on that. Our next question goes, what is the possibility of a fatal death after a first-time seizure? How can low sugar cause this?
Yeah, it is very rare for the first time seizure to go into up to fatal death. But it is rarely reported. Like as I said already, sudden unexpected death in epilepsy can occur. Most of the time, the seizure will stop within a few minutes, say less than 5 minutes. So you need to attend the person and call an ambulance and immediately bring them to the hospital. How low sugar, it depends on the person. Sudden decrease, even less than 50 or 40 can produce seizures.
Thank you very much, doctor, for sharing your thoughts on that. Our next question goes, how can I overcome migraine issue?
Yeah, migraine is one chronic headache where you have often have some triggers. Like some people will have fasting will induce headache, or some people will have overnight sleep deprivation will induce headache. So you identify what triggers you have and try to avoid it. And consult your neurologist to get medications regularly. Because these people know during acute severe headache, they will have some treatment for that. And for prophylaxis also, we have some medicines so that migraine can be prevented.
Right. Thank you very much, doctor, for sharing your thoughts on that question. Our next question goes, in case of malignant tumor, is there any chances of metastasis while excision? Is there any safety precaution to prevent metastasis?
Yes. Look, most of the brain tumors, they metastasis. Unlike other tumors in the other part of the body, most often you may not know, or your patient will be diagnosed only from the metastasis. The patient would have started with a tumor from the ovary, uterus, or prostate, and during which time the patient may not have any symptoms. But once it is metastasis to the lungs, they will have a cough and then only come to your doctor, during which time you see that it has already spread to them. Whereas in a brain tumor, most often it is the symptoms which comes first. Even a small growth will produce headache, vomiting, seizures, and when an eloquent area, weakness of limbs, hearing impairment. So early diagnosis, and they don't also metastasis. And certain malignant tumors, if at all you like ependymoblastomas. These blastomas, they can metastasize once you operate that. It can metastasis down into the spinal cord, not elsewhere in the body. It metastasis in the central nervous system, not elsewhere in the body. That is one of the major advantage of having a tumor inside the brain, wherein you have a yearly detection and total removal and no metastasis, unlike tumors elsewhere in the body.
Thank you very much, doctor, for answering that question. Our next question goes, if a person is having a seizure on the road, what would be the immediate and right way to help him or her?
As I have already discussed about the first aid measures, you need to call an ambulance and to remain calm and stay with the person. And if any tight clothings are there, you should be loosen it. And if the person is hitting their head, you need to keep some soft objects under their head and do not try to restrain. You just stay with the person till the ambulance comes, and you need to, if possible, you need to time the seizure, how much time the person had seizures, and you need to tell to the doctor who is treating.
Thank you very
Most
much, doctor.
most important thing is usually there's a tradition of giving them keys or iron objects. So that is something must be avoided. Nobody must do that. And if we think the patient might aspirate, we turn the patient to one side so that they don't aspirate.
Thank you very much to both doctors for sharing your thoughts on that one question. Our next question goes, is tumor caused because of too much usage of mobiles?
Yes, that's what I told you. Too much usage of mobile, a lot of research is going on where you keep the electromagnetic waves keep on stimulating. That's what I said. A tumor suppressor gene is being knocked off by radiation, may it be electromagnetic radiation or ionic radiation, which knocks off, and you can get this. There are researches going on that the patient developing acoustic schwannomas, that is tumor arising from the atrium, the nerve which perceives the hearing, and patient developing a tumor in that area, which is in a very deep part of the brain, and it is one of the difficult surgeries which can be done. So too much usage of mobiles also is not good for the health.
Thank you very much, doctor, for giving us that amazing answer. Our next question goes, is it better to check our brain condition by taking an MRI?
Unless you are symptomatic, it is not, at least in India, you don't, I don't think so. That is quite necessary to care. If you are asymptomatic, like if you are having a headache, may it be a migraine, chronic headache, you do a MRI or a CT scan and then find out that you are not suffering from any major illness. It is only a hardly migraine. If you are going to have a dull headache with vomiting, that to early morning headache, with the neurological symptoms, then you go for an MRI.
All right. Thank you very much, doctor, for giving us the answer to that question. Our next question goes, does stroke cause memory loss? If so, what is the rehabilitation?
Yes, it depends on the part of the brain that is affected by the stroke. Memory is primarily concerned with some frontal and temporal lobes. If that part of the brain is affected, they can even have memory loss. For that, as already discussed, they have to constantly engage their brain. They need some stimulation like crossword puzzles or Sudoku. They need to talk with the relatives and they need to hear the music so that the memory gets constantly stimulated.
Thank you very much, doctor, for sharing your thoughts on that. Our next question is, to what extent does depression affect the brain?
There is no measuring scale like that, but constantly thinking about something, your brain may not be going beyond that. It's like a thought block. So we need to come out of depression and consult a doctor. If there are any sleep deprivation or associated any physical problems that lead on to depression, that needs to be addressed so that they can have a stress-free life.
Right. Our next question is also quite similar. How does anger affect the brain? Is occasional burst of anger good for the brain?
So
Any
any
doctor? Yes, yes.
anybody gets anger at some point of time, we need to control that through some yoga or meditation or take a deep breath and do breathing exercises regularly to control your anger.
And
Yes.
one more thing, if I may
Yes.
add, any change in behavior or emotion like anger or a depression which was not there previously, we have to look out for a organic lesion in the brain also. Because in a person who's otherwise normal, a new onset of behavioral change or new emotional, and we really have to assess one. And two, any predominant emotional disability has to be treated like Madam said, because without that, we lose interest in life. We lose interest in health. We lose interest in food. So our brain really does not survive well on that. Yes.
Yes, thank you very much, Dr. Judge. I think next question also you can take it up. The deadlift that we perform in gym, does that affect the brain in long term? Because sometimes we get blackouts and headaches while deadlifting.
Deadlifts can increase the intracranial pressure because every time you're straining, lifting weights, the intracranial, the pressure inside the head goes up. It is safe if done in a safe manner, safe weights. You must know your limits. If you're getting blackouts, that means it is not good. Sometimes when they do deadlifts, the weakest part of the covering of the brain can give way, and the patient can end up with what we call as a CSF leak of the fluid around the brain. So it is not very good. So it has to be done in a proper way. And regular blackouts is not a good sign. It means you are going beyond the limit.
We will have our last two questions before we wrap up this webinar. So the second last question goes, I have a severe migraine along with dizziness and nausea with chest pain when I get tensed and depressed. How can I control it?
Yeah, once again,
The question is,
severe migraine along with
severe migraine along with
dizziness.
dizziness and nausea with chest pain when I get tensed and depressed. How can I control it?
Yeah, these symptoms can be coexistent with migraine itself. Migraine is well known to cause dizziness, nausea, body pains, or body like that. So you need to control your emotions and do yoga and meditations regularly, and get your consult your doctor to get appropriate medicines for migraine. Because migraine don't have any structural lesion in the brain. You will keep on taking CT or MRI scans, everything every time it will be normal, but you don't address your triggers like sleep deprivation, proper diet, etc. And you need to really avoid, reduce your screen time. That's also one of the reasons for aggravating the migraine.
And now we will have a last question. I think this question will really help the person if we answer him. So the question goes, I'm 79 years old. I had a heart bypass surgery 18 years ago. 4 years ago, a drunk cyclist hit me and I had a fall. Then I'm not able to walk in a straight line. I walk swinging like a clock pendulum with small steps only. I had consulted a neurologist and had a vestibular exercise 3 months ago. And 3 months ago, while returning from a shop, I felt vertigo and fell down. Is there any exercises that should be done by me? Please suggest.
head injury, following that post-traumatic vertigo, you need to really consult whether it is vertigo or any structural lesion in the brain now. Because any hematoma as discussed, no, those needs to be addressed before going in for conservative management. Plain vertigo, we need to check whether it is a benign positional paroxysmal vertigo and address it accordingly. The plain Vertin tablet will not work without the cause being diagnosed.
Yes. Thank you very much, Doctor, for sharing your thoughts on that. And one last question, I think this was asked multiple times. It says, is there any way we can train our brain to believe in ourselves? Yes. Dr. Jose, do you want to take it up?
Yeah, I think self-belief comes from practice, comes in belief in yourself, drawing up, concrete plans, following it through, removing laziness, all that. So I think it comes down to you ultimately about how much you're willing to invest in yourself to improve your belief.
Yes, thank you very much, Doctor, for giving us such closing remarks. To those who did not get their questions answered, you will get your questions answered via email, so you don't have to worry about that. So, with that being said, we have come to the end of this brain racking session. I should say a big thanks to all the doctors for sharing their insights. Thanks to the audience who have joined today to attend this fruitful session and making this session a wonderful and successful one. This was the webinar on understanding brain health brought to you by Kauvery Hospitals under the Hindu Wellness series. Thank you all. Have a wonderful and productive day ahead. And once again, happy World Brain Day to all of you. Thank you all and take care.
Thank you very much. Thank you.
Thank you very much, Douglas. Thank you, everyone.
Thank you for the opportunity. One last question I need to answer is that how long we have to continue the medications for seizure, one person have asked. So it's depends on the cause for which we have started the medicines, Generally, we give up to 2 to 3 years for seizure free, but it depends on the cause. If the person has any gliosis or any brain lesion, structural lesion, we need to continue maybe for lifetime.
Thank you very much, Doctor, for answering that question. It was very nice of you. Once again, thank you all once again for joining us on this webinar. Hoping to catch up with you guys soon. Take care and happy World Brain Day to all of you.